Hello, everyone. Before we get started, please take note that all participants are muted and video is disabled. We will be providing the slides after the presentation, along with an evaluation survey and how administrators can provide their information for the CEU credit. Please place your questions in the chat box, and we will try to get to as many questions as possible at the end of the presentation. Thank you.
Good afternoon, everyone, and welcome to this webinar on Respiratory Protection Program and N95 use in nursing homes. This is Christine Passeri, Manager of Special Projects at the Southern New York Association. I would like to first recognize and thank the New York City Department of Health and Mental Hygiene, our fellow nursing home associations, and all of our partners at the Office of Emergency Preparedness and Response for their continued support. We are happy to have with us today our presenter, Mr. Gary Schwartz. He is the President and Chief Consultant of Phase Associates. Gary has over 35 years of professional experience in environmental health and safety consulting. He specializes in all aspects of environmental health and has subject expertise in industrial hygiene, indoor air quality, biosafety, and respiratory protection. He also serves as an adjunct professor at Rutgers University and possesses multiple certifications, including Certified Industrial Hygienist, Certified Safety Professional, and Certified Microbial Consultant. We have much to cover today, so without further ado, I will turn this over to our presenter. Please welcome Mr. Gary Schwartz.
Thank you, Christine. I appreciate it. And good afternoon, everyone. I hope you can hear me. And I'm honored to speak with you today on this very important topic on respirators and N95s. And particularly we'll focus on N95s, but we'll talk overall about respirators. I just want to make sure everyone can see the screen and can hear me.
We can see and hear you.
Okay, great. Thank you. Okay, what I'm going to talk about today is N95s, which I mentioned earlier, the various types. The OSHA does have a standard, certainly under which includes N95s. We'll talk a little about the written program. There is a requirement in the OSHA standard about a written program. Some of the elements of that program. Then we'll go into qualitative fit testing, which is part of the overall requirements. OSHA enforcement, and then the state of New York PPE storage. All right, let me start with N95s, and I'm going to certainly open up the video. Certainly, I'm going to share with you the various types. So let's go through this slide first. And essentially, the N95 is exactly that. It purifies particles, including microbial materials such as COVID. And it is 95% effective. That's why they call it N95. Matter of fact, if you see any that are P100, it is close to 100% or 99.997% effective. But this is how they get that number. And reducing exposure to a 0.3 micron particles. I'll talk a little about that later. And it is certainly a very effective means for protection against the virus, particularly for any aerosol droplets. Right, so there are different types of N95s. I'll talk about that a little bit later, but there is what they call powered air purifying respirator type, and that's for folks who are not able to utilize an air purifying mask, such as an N95. All right, so In reference to N95, the experts in the respirator field to call it a tight-fitting mask. Essentially goes around the skin, around your chin, and there is in most manufacturers a metal band that goes across the nose where you're able to literally take your finger and roll it down along your cheekbone. With a loose fitting, which is your powered air purifying respirator, it's just as effective. The only difference is the fact that it is powered through a little motor, and that air is brought in through a filter system into your certainly your breathing area. And the other difference certainly is with a loose fitting or a PAPR with any sort of hose or no hose system, is that the tight fitting should be discarded. We'll talk about that discarding a little bit later, where your PAPR would be decontaminated and be reused. So your N95, this is a typical 95. I'm not endorsing any particular brand. This happens to be a 3M. They do have numbers on them. This is an 8210. And it is, N stands for, and I talked about the 95% effective, is not resistant. And it is effective reducing, as I mentioned earlier, 0.3 micron particle sizes. And give you a perspective on the right-hand portion of the slide are the droplets. And that is a droplet that's about 5 microns. Of course, it's going to vary. And a perspective on size as a human hair is between 60 and 120 microns. Just to give you an idea of how small this droplet could be from your nose or throat. These are the various types. What I'm going to do is I'm going to go open up the video, and I'm going to share some information with you on how to, these different types and how to don and doff. Let me share the simplest. This is a surgical mask. It is not considered a respirator. It has its limitations, certainly. And the method, if you notice what I'm doing, is holding the middle and placing it on my ears. I'm going to spread it down. I want to have decent coverage here. But the reason it's not considered really a respirator here is because there could be breaches around this area between your skin and your mask. Notice how I'm taking this off. I'm holding actually here to avoid, and by the way, one of the more important things is to make sure that your hands are washed and cleaned, just in case you accidentally touch your eye, or when you're moving it, touching your mouth area. So I'm still holding this to make sure that I'm still not, touching my fingers are not touching my eyes, and then I'll of course pull it off, and this will be discarded. We're going to bring it up to your KN95. We'll talk a little more of KN95. There it was, if you see the slide, it is, there was a study done by Journal of Medicine, Internal Medicine, and it is a range of filter efficiency. It's not, of course, 95. It varies between 53 to 85%. Now, do make sure that it is approved by the FDA under their Emergency Use Administration Program. And there is actually a list. You can look you can Google it. You can see the various manufacturers who do have KN95 and at least have that EUA listing. Again, this does have a small metal band inside. And of course, my hands are washed. I'll lift it below my ear, and the top part, certainly, I'll put this over my face and around the crown. Adjust this, and I will take my finger and walk gently down the cheekbones to make sure it's tight, and I'll double check here to make sure there's no breaches along here. You can make some slight adjustments on here. Right now I'm about 1/4 of an inch below my earlobe and right about the area of the crown. And the reason this is the case is because you want to have even distribution across your skull and your face. So I'm going to remove this and the bottom part. And I'm still holding this. And I'll take this off, and then finally I will wash my hands and hygiene purposes. There's other types I'll share with you. This is and this is really the same concept as the N95. This is your 8210. Very similar. There is a metal band on the outside as well. And the most important thing here is the even distribution between the straps, which will be certainly on the crown. And as well, this should be about 1/4 of an inch right at your earlobe area. And this particular piece here is to make sure you walk it down to the cheekbone area. There's another one. This is certainly NIOSH certified. This is approved. I don't need to talk to you about the manufacturer. This particular device has an exhalation valve, and the purpose of this device is basically to allow more comfort. The problem with that is actually as you exhale, you expire air. If indeed you are have an infection of sort, whether it's COVID or any other microbial agent, is that could very well go through this mask. But you see what happens as you exhale, the valve opens up. I know it's difficult to see the valve, but it's that black piece right over here. And there's more comfort features with this. Certainly there are straps, but I really don't want to talk much more about it because it really shouldn't be used right now in terms of this pandemic. Now I'm gonna move along here. So we talked about the different types of respirators. I'm going to mention also the fact that on the upper right-hand side, there are the FDA cleared surgical masks. In all these cases, certainly make sure that there is adequate room for wearing safety glasses. That's important too. You don't want to interfere or causing a breach into your respirator. Talked about the various masks already. The one on the bottom, I didn't have a chance to talk about it again. It's an N95, certainly, but the N95 etches for approval are on actually your straps. So you can see a little etching over here. You can see where I'm scrolling. And what I'm going to do one more, I'm going to go check out this.
Excuse me, we can't see you, Gary?
Okay, I'm going to start the video again.
Thank you.
Okay, no problem. So with reference to this one, this is the last one I want to share with you, is that this is a Moldex brand. Again, I'm not endorsing any particular brand here, but your NIOSH or your monograms are actually on the strap itself. I know it's difficult to see, but it's on the strap. This particular model does not have a metal band, but rather it's moldable, and it's be able to cater to different sizes. I believe there are different sizes for this particular manufacturer. But certainly this is an approval with NIOSH with an N95 or even higher, which is called the P100. I'm going to continue on. So we talked about the approvals by NIOSH, obviously. FDA does have their role as a medical device. This is considered a medical device, but does not test or certify these respirators. However, they did give an emergency use authorization for not only US manufacturers, but also overseas. So for example, if some of these KN95s are manufactured in China, it does require an FDA clearance. And there is a listing, as I mentioned, they're called non-NIOSH approved disposable filtering face pieces. So do take a look at that listing if indeed there is a need to have some KN95s. Make sure they're on the approved FDA list. So here's the difference in reference to surgical masks and N95s. You can see the various specifications. The more important thing is that loosely fitting is certainly one of the items that is not appropriate for protecting against COVID virus or the aerosol, where you have your tight fitting mask on your N95. Okay, so let me share a couple of things with you in reference to N95s, where you have some myths about N95s, where there are facts about the NIOSH approved. And see, having a NIOSH approval is very important. They go through a rigorous test schedule in terms of the particles and the efficiency of those particles trying to get through that mask, where a surgical mask is not. And you can see again, for your own reading, the various other facts and myths that are associated with N95s. Again, you can also see an approved list on the respirator listing that is put out by NIOSH. You see with the N95 why it's so important is because you do want to block, you do want to filter out the aerosol, the droplets, because it has the ability, it has a structure, it has a filter fabric to be able to do that, and to be able to block those various droplets. So this is a great pictorial of how this is involved with the prevention and the barriers to use with an N95. So again, here's another example of an N95. I covered some of this stuff in earlier slides, but this gives you a little more information and strength about what an N95 is all about. Yes, it is somewhat difficult to use. Some people complain that it is suffocating. Yes, the filter fabric is very, very strong, very, very tight. And of course, people are going to feel, you know what, I can't breathe. And that may be the case for many folks. This is why 3M and others decided to have a valve, in which I shared with you the valve earlier. And I'll share it again with you. This is what I was referring to on the picture, but it's really not practical at this point, effective, let's put it that way, for excursions in terms of encounters dealing with patients who have COVID. So here's the standard, and I'm going to cover very briefly some of the requirements. You can see how extensive it is. OSHA takes it seriously. They feel that besides engineering controls, which I will mention a little bit later about ventilation, is that this is very important. It serves as a very, very effective barrier against these viruses, and really becoming any virus. We're just talking about COVID, but certainly when the pandemic ends, there'll be something, unfortunately, around the corner, lurking its ugly head. So I want to mention before I go into respiratory protection, this is even in the standard, that when the most important control is engineering controls, and that is ventilation. And there's various ways. I don't have the time to start going into ventilation methods, but OSHA feels that, let's try this. Let's see if it's going to be feasible, if it's not feasible. In many, many cases, certainly in your industry, it is not feasible to have ventilation, and hence this is where respirators come to play. So you can basically see one of the purposes, your person-to-person transmission. It serves as a barrier. The program requires a what they call suitably trained program administrator, and that could be simply an infectious prevention practitioner or nurse administrator, someone who has an understanding of respirators, how they're used, what their disadvantages are, what are some of the regulations and provisions of the standard. It has to be in writing, and it has to be updated on occasion to make sure that certainly the trained program administrator has changed. That change has to take place as well. And a risk assessment has to be done. And what a risk assessment is, and I'll share this with you in a moment, is basically you have to do an assessment. Who needs a respirator? What type of job tasks are involved with wearing a respirator? Job titles, what areas? So there's a lot of things need to get involved with during that hazard assessment. Does everyone need a respirator? Well, in the case of entering a nursing facility right now for COVID, yes, you should wear your respirator outside the hallway, outside to put on it. But certainly there's other things that need to be done. What type of respirators should you go through N95 at close encounters versus just wearing a facial face piece? I think it's up to the individual. OSHA does allow some leeway in terms of the type of respirator, but it is strongly suggested as much as possible at close encounters to wear an N95. Okay, so another question that comes up is who is your program administrator? You need to identify someone, and it can be placed into the written program. And, as I mentioned before, is identify who could be highest risk for exposure to COVID. Again, I'm mentioning COVID, but there's other agents involved, certainly any of the microbial. And as I mentioned, anyone additional should be wearing an N95, or the entire staff and other personnel. All right, so we talked a little about the differences between the KN95s, N95s, and PAPRs. Are there certain individuals who feel, what, I need to have a PAPR for whatever reason? And there could be a lot of reasons to consider that, and versus an N95. So there should be a listing by grouping or by job title of who should be wearing what. I quoted this in the standard. This is the OSHA standard. It's numbered as 1910-134. And this basically requires the employer to evaluate the workplace. And this is pretty much what we were talking about in terms of who has a greater risk, who doesn't, what type of respirator should be worn. If not, then everyone should be really wearing the same protection. Okay, another question to ask about respiratory protection is what type? I mentioned a couple to you. I mentioned about 4 or 5 different types, and there are more than that. And how far do you go? Some have nose clips, some don't. I understand there is some difficulty obtaining the select group of respirators, but if you do have a selection, I think one of the things to decide is, do we go with something like the Moldex, which is right here, which does not have a nose clip but have different sizes, or you stick with something such as the N95. We talked about eye protection as well. Are these particular safety glasses that an individual wear, are they not interfering with the respirator? Okay, medical evaluations. It is required for respirator usage, and the reason this is the case is because you want to make sure that there's no particular underlying condition, respiratory distress, for example. Emphysema would be an example, bronchitis, and you don't want to have not only obstruction due to your pre-existing condition, but also imagine putting on N95. You have a double blockage potential for your inhalation or expiration of breathing air. So this is very, very important to have a medical questionnaire filled out. Sometimes you'll call them medical clearance. And certainly someone as a nurse practitioner or a physician would need to do this clearance. Again, it's a very simple form, needs to be completed and in private certainly, and submitted to your health practitioner. Again, so another question is, do you have an assigned physician or licensed healthcare through your facility to be able to look at that and review that medical questionnaire? All right, so there's different types of fit testing. This is on the upper right-hand side. This is an example of what one looks like. There are different types, different versions, different varieties of allowed fit testing methods. This is called the qualitative fit test method. And this is using a solution of fit text. There's actually a little hole in there in this hood, and they spray a solution in there. You go through various exercises to determine if indeed you can taste it or smell it. Again, this is part of the standard to be able to do that. And the reason that OSHA has this provision in there is they want to be able to see that, are you properly wearing this? Are there any breaches? Is the respirator too small or too large? Is it covering your chin? So with this, if you're not able to taste it for the various exercises of this fit test, it means that you have a proper fit. And this is put in writing, by the way. There is a record kept that you passed it or didn't pass it, of course. Now, facial hair is a lot of questions. Hair cannot be because it serves as a breach. And it will certainly cause some issues for having some of that aerosol enter into or through or around your mask. Anything now can compromise the fit. And you can see the various other types of items that can serve as compromising your fit. So fit testing, as I mentioned, is annually and has to be done certainly with the same model, the same style and same and size respirator. Yes, it is, OSHA has been a little softer this year due to the pandemic. And if you had a fit test, and let's say you had the 3M N95, you had a fit tested, say 2019, well, OSHA says it's okay, you don't have to get fit tested again until after the pandemic. However, let's say you had another type of model and make in 2019, well, what OSHA is saying is, you really need to get that new mask and model because there are differences in fitting. So the other question to your facility is, who will do the fit testing? What qualitative fit test supplies do you have? Unfortunately, there are some bit of scarcity in the supplies, and whoever the manufacturer is, so do make sure that you order well in advance before your fit testing. If indeed some of you in the audience are going to be doing the fit testing, it's very important to tell the subject or the person being fit tested to not to eat or chew gum, because there will be a factor, be able to smell it, because not only smell it, but also to taste it. So if you can't taste it and you're tasting a piece of chewing gum, then that's not going to help with the fit test. So you have to tell the individual that, look, 15, 20 minutes before, don't eat, don't chew gum, don't smoke or drink anything, except for water, of course. Okay, so disinfectant, you've read, you've heard about various disinfectant methods over the past 8-9 months. One method is hydrogen peroxide, certainly has been effective. This is just a photo of an example of a decontamination in progress and a little bit of a close-up of how it's suspended and hung so that you have the ability of that hydrogen peroxide to be able to penetrate the entire surface of that respirator. And that's the key for this. So it can be reused, disinfectant reused. Okay, so there are terms such as extended use PPE, where you can go from patient to patient. Again, you can see this individual with proper sized eye protection, isolation gowns, and of course an N95. So, and also gloves. Gloves need to be changed. There's concern about the contamination issue from patient to patient. The maximum time that PPE can be worn is not well defined. I want to emphasize that, not well defined. Studies have shown N95s remain effective for about 8 hours of continuous use. Again, it's too soon for any further conclusive information about that. Certainly, if the structural integrity in N95 is damaged or ripped, there's a section on the strap, it is visibly wet or soil, it needs to be removed. So reuse, if they remain functional, obviously to avoiding any sort of high risk contamination. It is recommended for full face shields for any aerosol generating procedures. That's very important, certainly more. And in addition to having eyeglasses, this is a second barrier. Obviously, avoid touching inside the respirator because your mucous membrane in your eyes is considered certainly a portal. And between usage, there is recommended methods to put into a clean paper bag with your name on it. And I mentioned already the vaporization of hydrogen peroxide using it and ultraviolet as well. Okay, storage is very important too. You can see the various photos, images I put in there about it, particularly the paper bag with your name on it, individually stored. The state of New York has a 60-day storage inventory requirement. So that's important as well, to maintain replenishment of that. And just to reiterate, a 60-day supply inventory was as of September 30th. There is a supply which triggers the time period for off-site storage as well. Particularly if you have facilities that say there's storage in a couple of states away, and it will require a number of days to travel. So there needs to be some sort of reasonable time period for off-site storage and to be able to dispatch and to bring back into that inventory period of time. There is also requirements for training, and the training needs to be formal. The training needs to talk about the type of respirator, how to put it on, similar to what I did before about putting and donning and doffing, any limitations. Certainly there's requirements. Maintenance, we talked about some decon procedures, individually bag them if they're going to be reused. So all this has to be done. It can be, certainly doesn't have to be something that's a face-to-face. If it needs to be done as a webinar, such as we're doing now, that's acceptable. There needs to be some sort of indication that that individual sitting in that class, whether it's remote or face-to-face, has an understanding of what the speaker was talking about or what the instructor was talking about. And that is, it is recommended to have a quiz for learning retention. It needs to be in different languages as warranted. So you need to be able, that individual needs to demonstrate the knowledge to correctly wear this respirator, and no matter what it takes. And really, to be quite honest, the most important thing about the training is the hands-on. There are various exercises you can do to be able to share with individuals hands-on besides what I'm doing now. And there's exercises that can be used as well. So the program evaluation, as I mentioned earlier, is dealing with medical evaluations, your fit testing, a written respiratory protection program. And your fit testing is certainly once a year, but even with this, when you're talking about the training, and I'm going to put this on, is that do make sure that, when you are donning and doffing, and I don't have this on fully, but just excuse me for this because I want to take it off pretty quickly, is the fact that, have individuals hold their hands like this and they breathe in, out, and be able to see if there's any breaches coming here when they're breathing out. That's another method as well. And that will determine if, there's a good fit. They may have to make a slight adjustment on their nose or around their chin area. So for me, this is a pretty good fit, as you can see here. Of course, without my safety glasses, etc., and its straps. In terms of OSHA enforcement, as I mentioned, there is a temporary enforcement guideline memorandum. It's basically, but it does not offer a blanket waiver. I want to make sure you understand that, or exemption with the respiratory protection program. So because of the pandemic, OSHA is giving some leeway and say, you know what, if you've had the fit test done and it's the same make and model, don't bother. If there's another method to do the training during the pandemic, such as a remote, like we're doing now, perfect. You can do that. It doesn't say, how many questions you have to put onto the quiz. It doesn't say how, but it's important to have an understanding for learning retention that people who are taking this class, that they do understand how to wear it. They do understand the limitations. So with reference to the last bullet there, what OSHA is allowed to do is they're going to use your discretion. If they obviously see a facility that no one has had any fit testing done, none of the training, there's no written program, OSHA has that discretion to do citations. But if they see a facility that already has a written program, they've done their good faith effort to do some training, they have record keeping, and also your fit testing with reference to quiz, then they're not going to cite you. They may just say, look, this is what you need to do after the pandemic. You need to strengthen the program. You need to enhance it a little bit more. So there is flexibility with reference to everything from extended use to reuse of the respirator. The decon we talked about, time limited to, again, the current pandemic. And it's been emphasized. That's what has been input into the memorandums, by the way. And it's a good faith effort. Now, I would suggest for any of the administrators out there is that you should check the website. It would be under OSHA.gov. They do have a section, a banner on COVID-19 webpage, and they'll give periodic updates in terms of enforcement activities and their compliance activities. In terms of record keeping, there is requirements. If a worker, someone is employed, is infected as a result of performing a work-related duty, and it is, under these bullets, confirmed case via the local health department under presumptive, positive, and lab confirmed. And if the case is work-related, and if it follows the criteria under what they call the 29 CFR 1904.7, which is the medical portion regulation under OSHA. Again, there's a lot of activities, there's a lot of due diligence to determine if this would be fit under the OSHA record keeping guidance. That's not the guidance, I'm sorry, it's under the requirement. So please bear that in mind to look carefully at the provisions and the regulation called 29 CFR 1904.7. Your New York City emergency supply, medline.com, that is for, obviously, most are well aware of the PPE stockpile developed for a backstop for healthcare organizations, only to be accessed when all other options have been exhausted. And the web URL is, you can see that there. www.medline.com. Okay, so I'm going to open up for questions, but before I do that, if any of you have any sort of questions on what I spoke about or any of the respiratory protection program or the OSHA standard, also if you need help on the training, if you need help on any sort of fit testing, you do contact me. My information is on this last slide. That is my mobile number. At times we are still in a COVID mode where our direct line is routed to our cell phone. So that's my cell phone and that's my email. Let me open this up to any questions, Christine.
Thank you, Gary. First, I just want to mention that I did receive a question outside of this chat box regarding entities that may have had ordered fit testing equipment maybe over the summer, and maybe they were told that that fit testing equipment only applied to certain respirators. Is there anything that you could tell us about whether or not that fit testing equipment can be used across brands of respirators?
Yeah, it's a good question. Yes, it can. So, there are a couple of makers such as 3M, Allegra, I believe. They can be used for any brand of respirator, as long as it's qualitative, which is really using solution over a hood. It's totally different for quantitative, which I really don't want to discuss at this point, but the answer is yes.
Okay.
May I just add a couple of things? Do make sure that it is deconned, the hood is deconned after usage. It can be used in Lysol or Clorox wipes or hydrogen peroxide, but it's very important to have a residence time before the hood is placed on another person. Unless we always have a couple so that we disinfect it, we let it rest, there's a residence time, and then we have another one to use so we don't disrupt the flow of individuals. Normally fit testing takes about 10 to 15 minutes per person.
Okay, so for that dwell time to allow the disinfectant to work on that hood, what would you say the average time for that is, or is that specific to each disinfectant that's permitted on the EPA's website for COVID?
Yeah, it will depend on the agent and how much dilution of there's water in it. So it will depend agent to agent. But we normally give it at least a residence time of 15 minutes before we use it again. Let it to also, plus the fact that you want it to evaporate, because you don't want to put another hood on where there's some drippings of that liquid solution on someone. So that's the other reason you want to have a decent time period.
Another question that I received outside the chat box is there, with the solutions being a little bit difficult to get because of supply chain and demand for fit testing now, as especially I believe in New York because of the growing pandemic and people needing fit testing, is there any specifics regarding whether or not it's preferred to say use the saccharin or the bitter? There are different types of scents, I believe, that can be used. Could you just mention something about that?
Yeah, I'm not sure I understand the question, but there are different solutions that can be used. One is a sweetener, which normally is saccharin. The other one's Bitrex, which is a subtle bitter solution. It's somewhat very difficult for people to sense it with smelling it. So you have to be fairly careful. Make sure that person can smell. There are some individuals who cannot smell or taste bitter solution, by the way. And that's where we would go to the sweetener bottle for another reason. So you really should have both if possible. If you can't, then obviously you have to go with one or the other due to the scarcity of supplies.
So how would you do that then with a staff member? Would you actually allow them to smell the sweetener just before donning and then see if they have a recognition of bitter or sweet before they actually go through the fit testing?
Yeah, there's a sensitivity solution that's used and it's stronger. So you would be able to spray that, and there's a certain number of sprays that you have to determine. Let's say there's 3 sprays and the individual says, yes, I can smell it, I can taste it. And then you go to the fit test solution and you can go forward. But if someone, you keep spraying, and let's say you're up to 10 sprays with the nebulizer, and then you ask, do you smell it? Do you taste it? No, I can't. I have a cold, or I just can't. I've never tasted lemon type or bitter solution. Then you have to stop, because it's not going to be effective, because they're not going to be able to smell it anyway or taste it. That's where you're going to have to go with a sweetener solution.
Thank you. Okay, so in the chat box, I do see 2 questions. So is there any, actually this is multi-part. So is there any solution for people who have facial hair? In some, cultures, facial hair is not shaved. It's part of a culture. So I'd like to know if there's any applicable solutions for N95 use, or whether a PAPR is recommended.
And that's one of the purposes of a parrot air purifying respirator. For those who, for some reason, it could be a medical reason why they can't shave, it could be a religious reason. And then the alternative would be a PAPR. Mind you, a PAPR is a lot more expensive, though. It varies in price. I would imagine $300 to close to $1,000, depending on the makes and bells and whistles on it. But that's the only alternative, is to use a loose fitting PAPR.
So if a PAPR is purchased, that can be used multiple times as long as it's also sanitized? Can that be used throughout a day for an individual?
For one individual?
Yes, say a person has their own PAPR, or because it's loose fitting, does that need any kind of testing associated with it? Or do they just wear it and they can wear it throughout the day? Or does that have to be sanitized as well? Are you aware?
The only issue is that when they remove it, they are maybe contaminated. Their hands could be contaminated. Where it's important that they, have active practice hygiene when they place it on, and certainly remove it. So then there's no issue of like accidentally touching themselves for whatever reason on the outside of the PAPR mask. So it can continuously be used.
Okay. The second part of that question is the length of effective time for N95 different for occasional use, or the same in 8 hours?
It can certainly be used for the 8 hours, but they have to practice good hygiene with reference to that, and then place it into a bag when they're not being used. As a paper example, and it doesn't necessarily have to be a paper bag. Paper bag allows some breathability, and that's why it's brought up versus a plastic bag.
Right. So just, I know you went over the major OSHA requirements, so I'm just going to let our members know, and everyone on this call know, that New York State recently announced that we're not in current extended use because of the 60-day stockpile. So we should be accessing the stockpiles and ordering at sufficient time. But we always stay cognizant of when extended use may become available or permitted, or shall we say permitted, if we see the supply chain disruptions similar to what we saw in the spring. So now I have another question. Is there any specific device for using UV light to disinfect the N95, and the exposure time of UV on an N95?
Yeah, UV is considered an agent for disinfectant. Unfortunately, I cannot answer that question in terms of how much time is required. I think the individual will need to go into more detail through the website or ask the manufacturer.
Okay, and a follow-up question to our question regarding the PAPR and individuals purchasing them. Are there any specific, so we say makers of PAPRs, or would they go to the same type of makers of N95s? Or, where would someone look for one?
Yeah, I believe that 3M, or which I believe owns, or Honeywell, are two large manufacturers. I believe North is owned now by Honeywell. So those will be a start for those two manufacturers. I would just Google, 3M, PAPR, or, as the acronym, or powered air purifying respirator. But those would be two manufacturers. Also, they go through distributors, these manufacturers. So it's best to use their existing, wherever they get their existing PPE, to try that first. If they can't, then certainly Google the 3M or say Honeywell for that matter.
Okay, we did receive a follow-up question. I know you weren't able to answer the question fully about UV light as being some sort of disinfectant, but could you just generally mention whether or not do you think all UV lights are the same for this? Is there a specific UV light that you have come across that some place has been using for N95 disinfectant purposes?
Well, I know that through Columbia University is dealing with the MTA in terms of agents, and I believe it's a UVC that's used. So that's a specific frequency. So in terms of other information, sorry, I don't have other information on disinfectant types at this point.
All right, here's another question. If the manufacturer states that the respirator can be used for 5 calendar days and there's no contact with a positive or suspected COVID individual, can they reuse it? Go ahead.
Yeah, yes, if there's no encounters, if there's no known contamination on their hands by touching other fomites or other surfaces, then yes. And of course, they're continuously practicing good hygiene, hand hygiene.
Right. I just want to reiterate, though, to everyone on this call that as part of a provider call yesterday with the New York State Department of Health, that we're not in an extended use period at this time, and that you should reach into your stockpiles and replenish as often as possible to try to maintain that 60-day stockpile. While we do welcome this question, there is no extended use at this time.
Yeah, and I would reiterate, it's always best to have a fresh mask if it's possible, realizing I know the scarcity of sorts, but you know, for your own health and hygiene, it's probably the best means.
Right.
Control.
In addition to that, I also want to mention another fact that came up yesterday, just to all the people on this call, is to, provide floor audits of people who are wearing masks, that they're wearing them appropriately in the cohorts when they're using N95s, and that your staff, when they enter the building, before they enter the building, they should be wearing a mask, and not after they enter the building. And as there is literature that we could send out regarding, I see another question regarding extended use. Extended use was distributed by the Department of Health earlier in the pandemic. You can reach out to me, respond to the email that you received regarding this webinar, and I'll get you that information. So is there any other questions? Please enter them in the chat box now.
And while you're waiting, Christine, I think it was a good point in terms of, when individuals are entering into the facility, certainly to don their facial face piece or respirator, outside, because as you're walking the hallway, there's a receptionist, etc. I mean, those individuals need to be protected as well, even though they're not with a particular resident. For them.
Correct.
I think it's very important for your own health, safety.
Exactly. So if there aren't any other questions, I just would like to remind all the participants today that we will make these slides available, and which includes Gary's contact information. I'd like to thank Gary and everyone who's on this call today for this important information. We will be We will also be sending out an evaluation survey of this presentation and information regarding administrator credits. I would like to yield back the few moments that we have left of this webinar. Thank you so much for everyone to join us today, and special thank you to you, Gary.
You're welcome, and everyone, stay safe, be well. And again, if you have any questions about anything, feel free to reach out to me. Thanks again.